This is the Rebound Coastal Bend, brought to you by Conviva. Visit us at convivacarecenters.com.
The pandemic has added a lot of stress to our lives, and young people, it's been especially hard to adapt to a new normal for them. That's led to some behavioral issues. And now in these times, we are committed to sharing information with you to help you rebound. Here are some changes in your child's behavior to look for and when to be concerned.
Most kids have gone back to school, but this school year is far from normal. The stress and anxiety brought on by the many changes during the pandemic have some young people feeling more distressed than usual.
Going back to school in 2020 for many kids means most schools are closed and many after-school activities are canceled.
With teens, especially with the disruptions that are happening around us during the pandemic, it's causing more anxiety, more isolation. And one thing that we know is isolation is never a good thing for teenagers, more so during a pandemic.
Shepherd Pratt Outpatient Services Medical Director Dr. Deepak Prabhakar calls recent data from the CDC about young people a pandemic within the pandemic.
1 in 4 individuals between 18 and 24, they are reporting serious thoughts of suicide. About 1 in 4 is also reporting either worsening or initiating new substance use. 3 out of 4 are currently reporting signs of mental health related issues, and 2 out of 3 are actually reporting serious anxiety and depression.
The teenage years can be tough enough, but during COVID-19, they become even more complicated.
When you take these 3 things together, disruption in school schedule, disruption in their social activities, isolation from others, their peer support network, all of these things are leading to higher anxiety and being relatively unsure about what's next.
Parents with moody teens may wonder how much moodiness is relatively normal and when should it be a cause for concern.
When we start seeing enduring depression, enduring anxiety, aggression, not just for several hours a day, but several days a week and then several weeks a month, at that point, we probably need to pause and ask ourselves, maybe this is something else that we are observing in front of us.
A change in attitude and a change in behavior also may be cries for help.
Total isolation, staying in bed way too long, straight out coming out and saying that they are having thoughts of harming themselves, sometimes in person, sometimes broadcasting these thoughts on social media.
Still, seeing any or all of these signs in their teen could leave some parents confused, overwhelmed, and wondering what to do or how to help.
As parents, we should take each and every thing fairly seriously. When a teenager comes to us, it takes a lot of courage for a teenager to actually ask for help. And then we should seek professional help.
Or call 911 if your teen seems as though they could hurt themselves or someone else.
There is no downside in seeking professional help when a parent feels that this is above and beyond their normal behavior, what the teen is manifesting right now. And if that's the case, seeking professional help immediately is really key here.
And Shepherd Pratt also offers in-person crisis clinic services, but in the age of COVID-19, it also offers a virtual urgent care walk-in clinic with online therapists and clinicians. In Towson, Mark Roper, WMAR 2 News.